we are reviewing the segments of the internal carotid artery. Viewed from the side, the internal carotid artery is tortuous. It originates at the branching of the external carotid artery from the common carotid artery. It travels through the neck, goes inside the petrous bone, passes close to the sphenoid bone, and very close to the foramen lacerum ligament, here labeled FLL. Then it enters the cavernous sinus and goes into the intracranial space. Hence, we talk about the internal carotid artery having an intracranial or cerebral part, a cavernous part, a petrous part, and a cervical part. The common carotid bifurcation and the external opening of the carotid canal are the boundaries of the cervical part. Here I have introduced a different side figure to show you the external opening of the carotid canal. I have now colored the cervical part of the carotid blue and indicated to the carotid sinus. In the Buthelier classification, which we will use for the rest of this video, the cervical part corresponds to the cervical or C1 segment. The C standing for carotid. No significant artery arises from this segment. Above C1, we have the petrous part, colored olive green. In the side figure, you can see a different perspective of this part. In the main figure, I have introduced the carotid canal. Notice that the external opening has a smooth and horizontal delineation, whereas the internal opening is raggedy and angled. I have brought in this new side figure to better show you the characteristics of the internal opening of the carotid canal. Notice the relative position of the upper and lower borders of the internal opening. The lower border plate constitutes the uncovered floor of the rostral-most region of the canal. Anterior and medial to the lower floor plate, you see a gap in the skull. This gap is only present in cadaveric skulls, and it is called the foramen lacerum. During life, this gap is filled with a cartilage, often referred to as the foramen lacerum ligament, as we previously mentioned. Now I have introduced the lingula, which with good imagination you can see here and more clearly here in this sphenoid. The lingula serves as the anterior attachment to the petrolingual ligament. The petrolingual ligament goes from the lingula to the apex of the petrous bone. I have brought in this new lateral figure to, at this point, help us visualize the elements constituting the petrous part of the internal carotid artery. The external opening of the carotid canal, the rostral and caudal edges of the internal opening of the carotid canal, the sphenoid spine, the foramen lacerum ligament, the petrolingual ligament, and the lingula. The petrous part in the Buthelier classification is divided in two segments. The petrous segment inside the carotid canal, referred to as the C2 segment. The almost constant artery arising from this segment is the artery of the pterygoid canal. This artery is often referred to as the Vidian artery in honor of Vidius, an Italian physician. The second segment in the petrous part, extending from the internal opening of the carotid canal to the pterygolingual ligament, is the C3 segment. The C3 segment is often referred to as the lacerum segment because it abuts the foramen lacerum ligament. No constant artery usually arises from this segment, although at times the Vidian artery does. Rostral to the petrolingual ligament, the carotid enters the cavernous sinus. The cavernous part of the carotid artery extends to the proximal dural ring and is called the C4 segment in the Buthelier classification. Now shift your attention to the lateral figure. The C4 or cavernous segment of the internal carotid artery, as we have just stated, expands from the petrolingual ligament to the proximal dural ring. It has 5 sections. The most caudal is the posterior vertical, the second one, the posterior genu, the third one, the horizontal section, the fourth, the anterior genu, and the fifth, the anterior vertical section. The anterior vertical section is only partially in the cavernous sinus region. A significant number of vessels arise from the C4 segment. The most consistent are the meningohypophyseal trunk and the inferior lateral trunk. The inferior lateral trunk sends branches that enter in the local foramina and the superior orbital fissure. Rostral to the proximal dural ring, we find the non-cavernous anterior vertical section of the internal carotid artery. This section of the internal carotid artery is in a peculiar space above the cavernous sinus, but not quite in the intracranial space, as you can better appreciate in this side figure. This space is bound by the proximal dural ring and the distal dural ring. This segment of the internal carotid artery is referred to as the C5 segment in the Buselier classification. The C5 segment, although devoid of branching arteries because of its peculiarities, deserve special attention. If looked from the back, as you can see in the added lateral figure, the proximal and distal dural rings join posteriorly. It is this arrangement that confers the tightly bent configuration of the internal carotid artery at this level. The C5 segment is often referred to as the clinoid segment because of its proximity to the anterior clinoids. The segment above, from the distal dural ring to the origin of the posterior communicating artery, which I have colored brown in both figures, is designated the C6 supraclinoid or ophthalmic segment. From it arises the ophthalmic artery, the first significant intracranial branch of the internal carotid artery, and the superior hypophyseal artery. I have now added a new lateral figure. It displays a representation of the base of the brain vessels. This is the carotid artery viewed from below, the ophthalmic artery and the superior hypophyseal artery. The C7 communicating or terminal segment extends from the origin of the posterior communicating artery to the bifurcation of the internal carotid artery. Two major arteries arise from this segment: the posterior communicating artery, here indicated in the side figure, and the anterior choroidal artery, here indicated in the side figure. After the C7 segment, the internal carotid artery bifurcates, forming the anterior cerebral artery and the middle cerebral artery. Thank you very much for your attention.